If you've had an angioplasty, there's a good chance you had a cardiac stent implanted. Joining us now is Dr. Craig Brodsky of Boca Raton Regional Hospital to explain more. First of all, what are stents and why are they used?
Well, stents are little metallic devices that sometimes have a type of medication in them that are used to help open up an artery that's clogged up. Typically, if a patient has a problem with angina or chest discomfort or has a blockage in an artery in the heart that causes the heart to get a lack of blood flow, they can be at risk of a heart attack, and a stent can fix that.
Are they removable?
No, once a stent is placed, it stays in the heart for good.
And is it something that the patient can feel once it's in?
No, typically most patients don't feel it. Once in a while, someone with a stent might feel a twinge of discomfort, but most often they don't feel anything at all.
Once it's in place, can it move, or does it really stay there in place?
It stays put. It's deployed with a high-pressure balloon, and it's placed so it wraps the sides of the artery. And once it's placed in there, generally it won't move, can't be removed. It's there.
And what type of patient should receive a stent?
Well, if someone's been having chest discomfort, which might be a sign of angina, they should speak to their doctor about it, getting a stent. Typically, they might have a test such as a stress test in order to see if they're at risk and if they need this kind of device.
And how many stents can one individual have?
Actually, most people have just one or two, but some people need more than one or two and have several. There's really no limit these days.
How often do they fail?
It's very uncommon for stents to fail. In the old days, when angioplasty was first invented, they did balloon procedures to open up an artery, and at that point, the failure rate was considerable. Stents were developed and have been getting better and better, and the failure rate is very low now.
And are there any risks involved?
Well, there are risks. Anytime you do an operation or a procedure, there's a potential for a problem. But the procedures are getting safer and better, and now the risk is about 1 in 250 for a major complication.
And what sort of complications could there be?
Well, there can be heart attacks, bleeding problems, or an infection, or even a stroke. But again, it's a very rare event now to have a problem with this procedure.
All right. Thank you so much for joining us. Boca Raton Regional Hospital sponsors our expert and underwrites Ask the Doctor.